Breast cancer. This slideshow was put together with information gathered by Heather, Bryce, Stephanie, which is myself, and Elaine Yellick, Community and Public Health, Instructor Wanda Carter. Breast cancer. This presentation was put together with information and work put in by Heather, Bryce, myself, Stephanie, and Elaine Yellick. Community and Public Health, Instructor Wanda Carter, and today is April 14th, 2014. Our thesis statement is, even though breast cancer is the most common type of cancer found in women, early detection of breast cancer requires having regular screenings to help find cancer in the early stages, contribute to minimal symptoms, and make treatment easier because the lesions are smaller. Symptoms. Some of the symptoms of breast cancer would be a new lump in the breast area or under armpit, thickening or swelling of part of the breast, irritation or dimpling of the breast skin, redness or flaky skin in the nipple area or the breast, pulling in of the nipple or pain in the nipple area, nipple discharge other than breast milk including blood, or any changes in the size or the shape of the breast, or any pain in any area of the breast. The common types of breast cancer include ductal carcinoma, which originates in the cells of the lining of the milk ducts of the breast. This is the most common type of breast cancer. Abnormal cancer cells that only affect the lining of the milk ducts but have not spread to other tissue in the breast are termed ductal carcinoma in situ. Another type of ductal carcinoma is invasive ductal carcinoma, which spreads to other parts of the breast and can also invade other parts of the body. Additionally, lobular carcinoma is cancer that originates in the lobes or lobules, glands that make milk, of the breast. Lobular carcinoma in situ is cancer cells found only in the lobules of the breast and does not spread to other tissues. Invasive cancer cells that spread from lobules to breast tissue in close proximity and can spread to other parts of the body are known as invasive lobular carcinoma. Excuse me, getting tongue-tied. Here are some of the screening procedures. One is a mammogram. It's a screening of the breast that is done by an x-ray. Mammograms are the best type of screening to detect breast cancer at the earliest stages. There's a breast ultrasound. It's a machine that uses waves and sound waves to provide detailed pictures, or a sonogram. There is magnetic resonance imaging, which most people know as MRIs, and it's a body scan using a magnet and a computer to provide pictures from the inside of the breast. A breast biopsy. This one seems to be the most painful of the four. It removes tissue or fluid to test using a microscope. Did you know? In 2010, statistics show that 206,966 women in the United States were diagnosed with breast cancer. 40,966 women died from breast cancer in the United States. Who's at risk? Breast cancer is generally found in women 50 years of age and older, although younger women may also contract breast cancer. 11% of all new cases of breast cancer are found in women 45 years of age and younger. Subsequently, the risk of getting breast cancer increases with age. For example, 3.49% of women 60 years of age will get breast cancer within the next 10 years. Accordingly, the projection forecast is that this representative percentage of 100 women 60 years old indicates that 3 of 4 out of every 100 women will contract breast cancer in this age group. Here is a diagram showing the ages and how the cancer will develop over the next 10, 20, and 30 years. Breast cancer was the most common cause of death among Hispanic women and the second most common cause of death among white, black, Asian Pacific Islander, and American Indian Alaskan Native women. This is just to go based on showing how the stats and the assessments pertain to ethical groups. So in 2010, statistics show that 266 women again in the United States were diagnosed with breast cancer. Percentage of assessments by mammograms in the last 2 years. So this shows races of women and the percentages of those diagnosed or assessed with mammograms in the last 2 years. So as you can see, Black and African American are among the highest, as well as white, with non-Hispanic in the running for third. Synopsis and common elements of breast cancer versus prostate cancer. Synopsis and common elements of breast cancer versus prostate cancer means breast cancer is the most common cancer in women. Prostate cancer is the most common cancer in men. Prostate cancer screening is as it relates to the prostate specific antigen. The antigen is not to exceed 2.5 milliliters. Breast cancer is most common among women 60 years of age and older. Screening of the breast by mammogram, breast ultrasound, MRI, and breast biopsy are ways that you can find out about this. Prostate cancer consideration begins from 40 years of age and older in males. In addition to the screening, prostate cancer is screened by digital rectal exam, which is a manual screening. The ethnicity comparison, highest probability for prostate cancer is in black males and least in Asian males. Highest mortality rate for breast cancer in Hispanic women, lowest mortality rate is Asian women. So they kind of have a similarity between the prostate cancer and the breast cancer, as it affects more of the, it seems, African American race. In our conclusion, even though breast cancer is the most common type of cancer found in women, early detection of breast cancer requires having regular screenings to help find cancer in the early stages, contribute to minimal symptoms, and make treatment easier because the lesions are smaller. Reducing the risk factors as suggested by the Centers for Disease Control will assist in preventing the occurrence of breast cancer in the U.S. population. Additionally, the assessment has provided the surveillance of breast cancer in the U.S. population. It has identified statistics of how many women have been affected. The case findings show that the ethical comparison or composition affected by breast cancer. The assessment also allows for making a forecast of the effects on women 60 years of age in regards to probable outcomes in the next 10 years. This information provides a means for American women to access and operate within the guidelines in order to minimize and even prevent the effects of breast cancer. Breast cancer is the most common, again, amongst women, and prostate cancer is the most common amongst men. Women and men both should adhere to regular screening schedules and learn to adopt the lifestyles needed to reduce their risk for contracting breast cancer and prostate cancer. Cancer, whether it affects women or men, is a health challenge which requires constant monitoring, assessment, and education to maximize health and wellness. I cannot stress how important it is for you to keep up with your regularly scheduled doctor visits. For women, I do know that there are things that you can do at home, such as giving yourself breast exams in the shower, raising your right or left arm and feeling in a circular pattern around your breast. If you feel any kind of lumps whatsoever, that should be something that should be taken to the doctor and discussed. This shouldn't be something that, oh, I'll let it pass because it's not that serious. It's always something that you should look after and take care of, no matter how small or minor you think it may be. Goes for men as well. If you know that you're over the age of 40, reaching 40, you need to make sure you get these prostate exams. The best thing about breast cancer and prostate cancer is the sooner that it's discovered and a plan has been put into place, the more likely that your life can be saved and that you will not become a victim of these diseases as far as a victim of death. There are things that you can do if you catch it early enough. I just suggest that we please keep up with our scheduled visits. Thank you.